Okay, so let's talk about alignment or posture during pregnancy. Alignment is basically just the lining up of all of your joints. Now, the classic picture that most women have in their minds of a pregnant woman is this hyperlordotic, like rounded lower back, sticking your bum out, tummy sticking out kind of posture. But that's not actually what we see most of the time. Actually, a far more common presentation for pregnant women is what I like to call the mum slump. So the mum slump is tucking the pelvis under, leaning back, jutting the hips forward, feeling a big stretch down here, belly sticking out, upper back rounded, shoulders rolled in, and the head jutting forward. We often see this like this. I know you know what I'm talking about. So this was first pointed out to me on a Julie Weeb course, and she said once you see it, you can't ever unsee it. And it's so true. Amongst mums, pregnant women and postpartum, what I see all the time is this. Either this or kind of just then getting stuck in this position. And let me tell you, once you have the baby and you've got this floppy newborn with this head that just like flops around all over the place, you're going to be hanging out in this mum slump position and you're going to get a little bit stiff and stuck there. This causes us to get a bit of a rounded upper back. It makes our lower back sore. It makes our bum go a bit flat. This gets all tight. It makes our tummy stick out. And sometimes it makes us get that kind of lump on the back of our neck that like old ladies have. The shoulders will roll in and the chest will get a little bit tight. Don't panic. There's no such thing as bad posture. Just when we hang out in the same posture all the time, things tend to get a bit stiff and tight. The kind of posture or alignment that we really want to be aiming for really isn't that complicated, and it's not just about remembering to stand up straight, because that usually ends up in this kind of over-the-top military posture like this. What we want to do is aim to get our ribcage over our pelvis. So if you see me from the side, my bum sticks out past my upper back. If your upper back is sticking out past your bum, it's probably a sign that you're doing the mum slump thing, and you just want to bring your ribcage over the pelvis. You also don't have to be in this perfect alignment all the time. It's what we want to aim for when we're exercising and as much as we can. But it's fine to slouch, it's fine to hold your baby like this, it's fine to stand like this some of the time. The body likes movement and the body likes variety. Trying to aim for this neutral alignment most of the time puts the least amount of stress on joints and muscles and makes us a little bit less achy and sore. You do need to have strong back and bum muscles for this. This is your scaffolding. So that's exactly what the program does, is it helps you strengthen those muscles so that it's actually possible to stay in that position. And we also want to stretch out all the bits that get tight. We want to stretch out the shoulders, the chest, mobilize the spine, especially the thoracic spine, mobilize the pelvis, really important during pregnancy, stretch out the hip flexors, stretch out the hamstrings. This will help us maintain that more neutral alignment. So just to recap, most women aren't actually hyperlordotic, although some are. Most women tend to hang out in this mum slump, especially during pregnancy, and most of the time we want to aim for more neutral alignment, especially when we're working out.